Module Overview. This foundational module introduces the concepts, principles, and professional expectations of bedside care within the context of modern, ethical, patient-centered healthcare. It lays the groundwork for all subsequent modules by emphasizing not just what bedside care is, but why it is critical, highlighting the human, clinical, ethical, and legal aspects. 1. Understanding infection and disease transmission. Infection. The invasion and multiplication of harmful microorganisms in the body. Pathogens. Disease-causing organisms such as bacteria, viruses, fungi, and parasites. Common healthcare-related infections include urinary tract infections, UTIs, pneumonia, MRSA, C, difficile hepatitis, BC, influenza, COVID-19. HHAs must treat every client and bodily fluid as potentially infectious, regardless of known health conditions. Definition and scope of bedside care. Bedside care refers to the direct physical and emotional support offered to a patient at their bedside. This involves activities aimed at ensuring comfort, dignity, cleanliness, emotional reassurance, and medical safety. Core components include personal hygiene, bathing, grooming, oral care, mobility support and repositioning, nutrition and hydration assistance, toileting, incontinence, and catheter care, monitoring vital signs and early signs of complications, communicating with empathy and accuracy, emotional and psychological support. The scope of bedside care varies by setting, hospital, nursing home, home care, and patient condition, post-surgical, chronically ill, elderly, immobile, palliative, etc. Historical and cultural perspective. Bedside care is one of the oldest elements of medicine, dating back to times when healers, midwives, and caregivers provided home-based comfort and treatments. Over time, the practice evolved with the Florence Nightingale era, introducing hygiene, compassion, and nursing systems. The rise of institutional healthcare, focusing on clinical excellence and technical skills. The modern emphasis on holistic and culturally competent care, respecting individual beliefs, communication styles, and backgrounds. Understanding this historical and cultural evolution helps caregivers connect their role to a rich legacy of healing, humanity, and service. Principles of quality bedside care. A competent caregiver upholds 6 core principles: compassion, treating patients as individuals with emotional needs; dignity, maintaining privacy and respecting autonomy; safety, following infection control, fall prevention, and correct lifting procedures; communication, ensuring clarity, confidentiality, and active listening; competence, demonstrating correct techniques and professional knowledge; responsibility, acting in the patient's best interest and reporting concerns. These principles align with national and international codes of conduct for caregivers, such as the Nursing and Midwifery Council (NMC) Code, UK American Nurses Association (ANA) Standards of Practice, WHO Patient Safety Guidelines. Patient rights and ethical considerations. Bedside caregivers must be fully aware of patients' legal and ethical rights, including informed consent. Patients must understand and agree to care plans. Privacy and confidentiality. Avoid exposing bodies or sharing personal health info. Right to refuse care. Patients can decline treatment, and this must be respected. Cultural and religious freedom. Accommodate beliefs and rituals where possible. Equal treatment. No discrimination based on gender, age, race, ability, or income. Understanding these rights is critical to avoiding ethical violations and legal liability. Interdisciplinary roles in bedside care. Bedside care is not isolated, it is part of a team-based model involving nurses, doctors, physiotherapists, nutritionists, social workers, family caregivers. Effective bedside care involves knowing your scope of practice, working collaboratively, and escalating patient needs when beyond one's role. Communication in bedside settings. Clear and compassionate communication is a cornerstone of bedside care. This includes using calm, respectful tone and body language, listening to patient fears, discomforts, or questions, explaining each procedure before performing it. avoiding medical jargon with patients and families, documenting care accurately, and reporting changes promptly. Communication should also be culturally sensitive, inclusive, and trauma informed. Safety protocols and standard precautions. All bedside caregivers must adhere to safety and infection prevention standards, such as hand hygiene before and after patient contact, wearing gloves, aprons, and masks when needed, safe disposal of waste and contaminated materials, keeping the environment free from obstacles, fall prevention, knowing how to handle patient emergencies. These are guided by WHO's 5 Moments for Hand Hygiene, CDC's Standard Precautions, OSHA's Injury and Illness Prevention Programs, IIPPs. Challenges in bedside care. Common challenges include emotional burnout and compassion fatigue, patient aggression or non-cooperation, language and communication barriers, limited resources or time constraints, navigating complex family dynamics. These can be addressed through resilience training, teamwork, and supportive supervision.